Okay. A little bonus for coming to class today. I'll show you some test questions that would be very similar to the questions that are on the final. All right. So let's see. See if you can answer these, because these are all questions that we've kind of gone through. We've gone through the material. So take a look at this one, number one. And what do you think the answer is? How many say A? B? C? D? Now that was on all the options. So we'll try it again. You have to answer. It's like an exam. So you have to answer. Okay. A. No one says A. B. Okay. C. Or D. And the answer is C. Because this first one, that they're lower for them than the highest ones are for these ones. The second one, no, doesn't have to have made a mistake or knowingly made a mistake, right? It's not true. Third one, rates are higher in the no fault. No, they're lower. Okay, how about this one, which is not true? How many say A? How many say B? How many say C? How many say D? Okay. Yeah, so D, right? Because all these things are true. How about this one? How many say A? B? C? D? The answer is D. Yeah, because remember that this type of, so this is where you have to know the differences between the different types of damages. So, and there's like, so if you go back and look at the lecture, you'll see there's 3 different types. So this one is the only one that deals with this type of damage. Okay. How about this one? Let me say A, B, C, D, E. Ding, ding, ding. It's E. Well done. How about this one? How many say A, B, C, D? And the answer is ding, 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 ding. Okay. Now this one we haven't gone over yet. So take a look at this one, and then we'll go through. This will be in there, somewhere in the lecture today. This will be in there. And so then you've got to figure out I'll ask you at the end which one this is, which is the answer. Which one do you think? C? Yeah. No, it's not. I'll give you a hint. It's not C. So there. Okay. And then we'll probably go through these ones as well. Okay. Any questions about anything before we start? So I'll do this every time. For those people who come to class, we'll go through and we'll just do some questions on to just give you a sense about the types of questions that are going to be on the final. Okay, last time we were talking about debt and deficits, and we're talking about basic civics lecture. Today we'll move it more to healthcare, but to understand kind of because we're talking about Medicare and Medicaid and some of the proposals are out there right now to basically raise the retirement age for Social Security, to raise the age of Medicare, to limit Medicaid that goes out. Also, there's proposals to means test Social Security and Medicaid care, which basically means is that you would look at charge people based upon their income once they get over 65. So there's a lot of potential changes out there, and a lot of calls that Medicare and Medicaid are going broke. And Social Security are going broke. So we'll kind of look at that in terms of our Medicare and Medicaid going broke. So we started saying is that, well, the government runs a deficit every year. Well, not every year. Last time they didn't run a deficit was 2000 when Clinton's last year in office. They ran a surplus, meant that they paid off the part of the debt. So remember, the debt is the accumulation of all those years of deficits. And so, well, what's the debt right now, the current debt in the US? We put it there last time. It's about $31 trillion, right? About $31 trillion. What's the size of the US economy? Like how much money is, if you add up all the income that everyone makes, what's the size of the US economy? It's about 18 or 19 trillion dollars, which means that if they took all the money from us in a given year, it wouldn't pay off the debt. They'd have to basically do it for 2 years in a row, take all the money to pay off the debt. Next question, is it okay to go into debt? Just in general. So we're going to talk about just us, and then we're going to talk about from a government standpoint. Is it okay for us to go into debt? So here's some reasons why you might go into debt. Vacation, nice clothes, cars, house, or education. So would you say vacation? So if you had a credit card, could is it okay? Is it okay? Or under what conditions is it okay to go into debt to go for a vacation? I guess if you really need a vacation, right? But of these lists, which ones are usually sort of seen as good reasons to go into debt versus not good reasons to go into debt?
Car.
And I think I'd leave car out of it. Cars you oftentimes have to do just because it's so expensive. But the problem with cars is that the value of cars goes down. So that if you buy a car for, $20,000, is that, and you have it for 5 years, your car is probably worth $10,000. But if you buy a house for, $200,000, then in 10 years, hopefully your house is worth more than that. So you want to look at things that go up in value over things that don't go down, that go down in value. So cars tend to go down in value. Education. Suhail, we talked about last time, said traditionally it's been a good thing to go into a good investment to go into education because salaries of college graduates tend to be a lot higher than salaries of people who don't go to college traditionally. Is it okay to borrow money? Yeah. How would you rather borrow money from a credit card or from a bank? Why? What's the interest rate you pay on the credit card? Yeah.
around 20%.
Yeah, it's about 20%. Mhm,
First, I think if I get a lower APR,
mhm.
and by having a lower APR, you have a higher chance to pay it off compared to a higher APR.
Yeah, so bank is 5%, credit card is 20%. So that's why credit cards is usually a bad way to go into debt. Because, and so people who, who have credit cards and think of their credit card limit as like is if you're at your limit, then you can't spend any more money. But if you want to spend money, then you pay off some of your credit card debt. That's probably not a sound way to do it. Instead, you want to pay off your credit card debt as quickly as possible because they're charging 20% off your credit card debt. Okay. So the lesson here is that in general, for individuals, you want to, debt is okay if it's going towards things that are going to gain in value, either your education or a house. Debt, people go into debt all the time to go on vacation. So it's not like it's, unheard of to do it. But just from a pure investment standpoint, is that, the idea is that you want to, it's okay to go into debt for things that are going to go up in value, are going to lead to value, but not necessarily things that go down for value. Now, governments are different, and governments are different for a couple different reasons. So like for us, if we have a job and we go into a recession, right, then what happens is that, we might lose our job, or that we might, stay this, our incomes might stay the same. But if things go well, it's harder for us to go ahead and to switch jobs and get more money. I mean, that's what people do, but it is something for which traditionally it's been harder for people to switch jobs and get more money during good times. Whereas for government, when things go well, the tax revenues go up. And when things go poorly, the tax revenue goes down. So governments face a real cyclical type of change in their how much money comes into them. They can also tax people. So if you think about how you make money by getting a job, right? Government makes money by taxing people, and that the government can come through tomorrow and just change the tax laws. They can say, well, we're going to raise your taxes by 5%. So it means that government has a lot of control over how much money they bring in. They can also borrow money. So, you and I, it's harder for us to borrow money. Banks won't lend you money usually. I mean, not, especially at your age, they won't lend you money. Credit cards, you can borrow money from credit cards. You can use them, but you're going to pay huge interest rates. Parents, family members, maybe comes with it's problematic though. So for people like us, for most people, it's difficult to borrow money. Governments though can borrow money easily, because governments can just sell treasury bonds. So if the government wants to borrow money, the treasury just issues treasury bonds, and people buy the treasury bonds. What happens when people stop buying treasury bonds? Well, what happens like in a country like what's a good country? Bolivia. Bolivia a few years ago was they got into financial trouble because they kept the government spent too much money, and more than they can get in taxes. So they decided what they were going to do is they were just going to basically just print money. So they literally print money. And so at the time, for a time there, the biggest import into the country was the paper that money was printed on, because it was a special German paper. And so they were using they were printing so much money, is that people had to, that the government had to import all this. And that prices were rising so high that people would go into a restaurant and that they would order something. And by the time that they got their bill, the prices would have gone up, because they're just raising prices constantly. So in cases like that, what people started doing in Bolivia is they started to get television sets. So as soon as they got money, they'd go down and they'd buy a television set, and then usually in a box, and then they just keep it. And then when they wanted to buy something, they'd go down and they'd sell the television set, and they'd take the money and buy something. But as soon as they got paid, they just turn around and buy another television set, because money the prices were going up so fast that money was just becoming worthless. You might have, I don't know, 1,000 pesos today, and it could maybe buy you a loaf of bread, and tomorrow it wouldn't buy you anything. So therefore, you need to put your money into something. And so people were putting their money into into televisions. Televisions kind of became the money in situations like that. So that's called hyperinflation. And then what often happens in situations like that is that governments don't get enough, they can't get enough, they can't sell enough things abroad. And so they keep borrowing money from other countries. And then finally they say, well, we're going to just default on our debt. So countries do come through in default, which means that, all those people who have bought treasury bonds and things like that in Bolivia, they wouldn't get any money back. So they'd lose their money. So the US, the US is seen as a safe financial place because treasury bonds are seen as something that the government will definitely pay for. So people buy, like a lot of retirement funds are, you can buy a safe retirement, investment funds like money market funds. They're basically treasury bonds. They're just buying treasury bonds because that's seen as really, really safe. And the reason it's really safe is because they think, well, because the government can come through and just print more money, right? They can, if they need to. So the idea then is that what should be happening is that in good times, the government should be running a surplus, and in bad times, that they should be running a deficit. Because in good times, what happens is that Medicaid rolls in good times go down because people get jobs, and that unemployment goes down, so the government doesn't have to pay out as much there. So in good times then is that the country should run a surplus. And in bad times, what happens is that people get laid off, so Medicaid rolls go up, and so the government's spending more, and income tax revenue goes down, so they're running a big deficit. So what you should see is the cyclical kind of nature whereby if we're in an economic boom, the government is in a surplus, and if we're in an economic recession, then the government should be running a deficit. What you see though is that this is the federal debt over time. What you see is that, well, basically, it was going down, down, down. The reason it was going down so much in this period is because inflation was so high. So inflation in the 1970s was really, really high. And when inflation is high, it means that the value that the government owes becomes, what the government owes becomes less. So for example, if you owed $100 and suddenly inflation, went rampant, that $100 that you owe would not be worth very much. So therefore, one of the ways that governments can get out of owing a bunch of money is that they just have inflation, and then they get more tax revenues, but what they owe remains the same. So anyways, so it went like that. Then you can see is that, you start to see that the Reagan tax cuts here. This is when Reagan did a big tax cut. So the deficit rose. Then Clinton put in a tax, well, Bush actually, the first Bush put in a tax increase. So deficit fell. And then Bush 2 put in a big tax cut. And so they rose. And then you have the recession here. So it rose again. And then you have the Trump tax cuts, which would then led to increases, and that you also had COVID. So you've seen this dramatic increase in the amount of debt. So the problem is with it is that if you don't, a lot of those periods have been good economic times, which means that you would hope that they'd be running a surplus and paying off the debt. But instead, what's been happening is that, it's become popular easier just to keep cutting taxes all the time. So they've kept cutting taxes. So what's the way out of this? Well, one way, what they've done since 2010 is they did what's called quantitative easing, which basically means what the government did is that the Treasury would send out Treasury bills and the Federal Reserve would buy them up. So it's kind of like, if the Treasury needs to raise money, and so they say, okay, we're going to we need all this money to come in. And the Federal Reserve Board, who's the one who actually controls the money, they just bought them up. So that's what's happened. And that's what they did is they dropped interest rates to zero so that interest rates on borrowing money was almost, so they basically made money freely available to banks, which is why there's been, so low interest rates for all these different years. The problem with that has always been is that it was going to lead to inflation. And so one of the reasons why we're seeing inflation right now is because for years they did this period of just having easy money, and they always knew at some point that they were going to have to come through and tighten up. And the way you tighten up is that you raise interest rates. And so as soon as inflation started to come up, they started raising interest rates. And so that's why you're seeing all these inflation prices changing so much. And you're also seeing interest rates going up, is because they did this long period of basically of just printing money. But that's one way to do it. The other way is to raise taxes. So if the government wants to get rid of this $31 trillion in deficit, what they could also do is just raise taxes. So, the problem with raising taxes is that, like, if they said, well, good news, we're going to get rid of the deficit by by taxing everyone 100% of your salary. So this year, everything is going to be taxed. What would happen? Well, for one thing, people wouldn't have money to buy things like food. But the other thing is that the economy would just fall into a cliff because no one has any money to buy anything. So nothing gets produced. So part of the problem, if you go through and you try to just raise taxes right now, is that you worry that there'll be an economic downturn, especially if you go through and if you tax just, people, regular middle-class people, then what happens is that they don't have as money to buy things, and that causes your economy to go down. So really the only way out of it is to tax kind of the upper 1%, because the upper 1%, they have lots of money. And so their consumption, the amount that it's going to hurt the economy is not going to be impacted if you tax, which is why you hear, like those who promote taxes, like Bernie Sanders and Elizabeth Warren, they talk about taxing the 1%, because it's not that they don't think that, that there should be fairness, but just that the people who, if you tax just the middle class, regular people, if you raise taxes, then it's going to go into recession, and then your tax revenue goes down anyways. But here's the problem that you fix. You as a young person, is that right now, if you think about we're $1.38 trillion in debt, right? That means that that's about $9,000 per person just to break even this year. So if they wanted to break even and not run a deficit right now, they'd have to tax every one of us an additional $9,000. So raise your hand if you could easily pay $9,000 extra this year in taxes. It'd be pretty tough, right? So that's why, when you start thinking about running a deficit, is that, it starts to become, like paying off your deficit and running a balanced budget. Just by raising taxes, it means they'd have to raise taxes a lot on people, or you have to raise taxes a really lot on people who earn more than $500,000 a year, or as like one of the proposals for Elizabeth Warren is that you tax wealth, not income, but wealth, because people who have money, they're typically pretty good at not, at hiding it and not really having much income because they don't want to pay income taxes. So what they do is they put it into business, or like what Trump's did, right? Trump, shows that he has losses every year, even though they're putting money into various things. That's a standard way that people with money kind of avoid getting income, because they don't want to pay income taxes. So the proposal is that, well, don't tax income then, just tax wealth. So, you pay a certain amount. If you're above $500,000 or a million, I think it's 10 million. I think if it's above 10 million, then you pay a certain percentage, like 1%, every year of your wealth. So that's one way to get out of it. The problem is that if we said, well, we want to pay off this $31 trillion, is that comes out to about $208,000 per person. So it means that every one of us, to pay off this $31 trillion, would have to pay $208,000. So who has $208,000 that they'd be, extra this year that they could put towards paying off the debt? Yeah, do you? Great. Okay, there's one. Anyone else? Come on.
I'll take it.
Oh, you'll do it all? Oh, I see. Okay, thanks for that. Okay, so that's the problem with taxes. That's why, if you think about that, how are we going to, solve our debt problem, which is going to be the same question as the Medicare. How are we going to solve it? It's like, well, taxes becomes problematic because, one is that we just owe so much as a country, is that most, they tried to just raise taxes on people it would be tough on people. All right, the other one is that you raise taxes, raise revenue by growing the economy. So this is by far the favorite one that they try, that governments try to do, because it's, no one wants to have their taxes raised. And so therefore but everyone would sit there and think, yeah, sure, I'd love to see my income raised. And so that's the idea behind was Reagan's trickle down tax cuts, as he said, oh, if we cut taxes, that actually will lead to higher growth. And so the extra growth in income will actually pay for the tax, tax cuts, and didn't work. But it's also why there's Biden's infrastructure bill that they put through, right, last year. The whole idea behind the infrastructure bill is that you're going to invest now in order to make better roads and bridges and internet and all these different things, with the thought being is that if you do this, that you're going to get more, you'll create more prosperity in the future. And it's the same thing with young people too, is that, the idea is that you get more educated young people, and that raises your country, that raises your GDP and such. And so that's the rationale for why it is that, the University of California subsidizes education for people. It's because it's sort of seen as, one is good for people, but also it's good for the country as well, to kind of educate people. Another way is to have immigrants, right? Immigration tends to be something that creates more people who work and raises income. So, and then the fourth option is that you basically start cutting things. So rather than raising taxes, rather than trying to get more revenue, what you do is you're trying to cut stuff. So right now we have $1.38 trillion in a deficit. And so if you start thinking about, well, what could you cut, right? Well, if you cut all of defense, so we had no more army, that saves you about $676 billion. If you cut all of Medicare, that saves you about $755 billion. If you cut all of Medicaid, that's about $9 billion. So if you cut Medicaid and Medicare, is that then you would eliminate your deficit problem, which is why when so if you look at these things, what do people want? What do Democrats and Republicans want to cut? They don't want to cut defense. You never hear that they, except for Ukraine aid, but you never hear that they want to cut defense, right? Discretionary funding, well, that's the things like national parks and things that people like. So even when they start talking about discretionary funding, the problem is that's where most people, roads and things like that. So you don't want to cut that. Net interest, you can't cut that because that's what you owe to pay off the $31 trillion on the deficit. So you can't cut that. Income security is basically different types of unemployment insurance. So you could cut that if you wanted to. Social Security, that goes to the elderly. Problem with cutting Social Security is that older people vote. So so that's problematic. Medicare, that's older people as well. Older people vote. So what's left then is basically Medicaid, things on young poor people. Younger poor people are the things that are easier to cut. But you can see why they're attracted to trying to cut, to try to cut these big social services, because it's like, well, 1.38 trillion is that, what if you lopped off, what if you lopped off, 500 million or billion from each of these different ones? So that's the problem. That's the problem that you face with cutting, is that most of these things are tough to cut. And so what it leads is basically Social Security, Medicare, and Medicaid as the things that they want to cut. All right, so the way Social Security works, right? So Social Security is for the elderly. The way Social Security works is that, like right now, we pay for people who are retired. So if you look at if you get paid, you'll look and you'll see that there's like a little tax for Social Security tax. So what that means is that they're taking out money from your Social Security tax, and that they're giving it to people who are older right now. What they're not doing is they're not taking out money from your Social Security, from your paycheck and putting it into an account for you. So one of the proposals that's been floated, and it's done in other countries, I think Singapore does this, is they have individual retirement accounts. So what they do is that it's like forced savings. So they sit there and they'll take out money from your paycheck and they'll put it into account in your name. And then when you become older, then you can access it. So that's something that's attractive because then the government doesn't have to worry. I mean, because the problem right now is that, if we pay for older people and these old people keep living longer, that means that we're going to keep on paying for more and more people who are living longer. And if you have fewer younger people, then you have fewer people paying for more and more older people who are retired. So what this shows is that back in 1960, is that you had about 5 workers for every person who was retired, got Social Security. So what was in 1960, what was the average life expectancy? What do you think the average life expectancy was in 1960? About 65. What age did people retire? About 65. So it meant that by the time that sort of retirement age hit, half the people were dead already, right? Because the average is 65. That means, people are going to be dying somewhere around there. And that there weren't that many people who were definitely 80. Well, what's the average life expectancy now? Well, it's about 78, right? 78 years old. But if you reach the age of 65, then it's more like about 90 in the early 90s. So it means that people who are going to reach 65 who are going to retire, they have 25 years ahead of them of essentially not working and just getting Social Security. So now the ratio is approaching more, about 2.5 to 1. And by 2030, they figure it'll be 2.2 to 1. That means 2 of you will be supporting me in my retirement. So what that means then is that that you can look at this and think, uh-oh, there's a big problem, right? Because that the number of workers is going down. The number of people who are retiring are going to be going up because they live longer. And so therefore, that's a problem. So what they do is that they basically create a trust fund. So there's what's called a Social Security Trust Fund. Because the government has actuaries and they can look at this, they can project out how many people are going to be retired in 2030, and they can figure out kind of what the payments are. And so because of that, then what they do is that they essentially have a fund. So right now that money that you're paying in your Social Security, it's not only going to people retired now, it's also going to just a fund that sits out, that the government has, that's essentially supposed to fund Social Security in the future. And so this trust fund, it's not part of that government's expenses that we kind of looked at. It's separate from that. It's just a big chunk of money that the government has invested in whatever. But they keep it as a way to pay off Social Security in the future. And so, this is the Social Security Trust Fund then, is that they have their income and they can project their expenses. And so what they do, like in this period, is try to, get a lot more money into the trust fund to build up a surplus, right? So here's the surplus, knowing that at some point is that they're going to essentially start using it up. And at some point then, is that then they'll be out. So what happens if they project out that the Social Security Trust Fund is going to run out of money? What can they do about it? Well, they can just raise the amount that they take out from our paychecks. So every once in a while they'll come through and they'll say, oh, we're going to have to increase the Social Security contribution. Because what they're looking at is basically projecting out how much they're going to spend, how many people are going to be alive, how long they're going to live for, and then how many workers they're going to have. And based upon that, then they can project out kind of how much money they're going to need. So for Social Security, what you'll hear every once in a while is you'll hear these things. They'll say, oh, is that they initially have projected is that the trust fund would last until 2057, but now they're projecting that's going to last till 2030. And so, it's going to then run out of money and there'll be kind of calls to do something about it. Well, it's an easy fix. I mean, why do the projections change? Well, because life expectancy changes, the amount that they pay out changes. So if they come through and they say we're going to pay out more in Social Security, then that's going to decrease the amount in the trust fund. And so then what they'll do is that then they'll have this debate. And so your debate is either that your choice is either that you limit who gets Social Security. So you say to people like me, oh, too bad, if you have income after you retire, then you're not going to get Social Security. So you tell that. Or what you do is you say that we're going to reduce the amount that you get for Social Security, which really hurts people who depend upon Social Security. Or what you do is that you say we're going to raise the taxes on people who are working now to pay it off. But those are your choices. So I think most economists don't really worry about Social Security. I mean, the trust fund, because they say it's going to go broke, but it's fairly easy. The solutions are fairly straightforward, and that there's not that much uncertainty about it, because they can pretty well predict how many people are going to be alive and what the life expectancy is going to be. So they can pretty well predict retirement. They know how much they're going to, they know how much they control, how much people get paid. So they know that. So and they know how many workers there are. So, they can pretty easily go through and figure out how much money they think that they're going to need for the Social Security Trust Fund, and and how much they have to take out in taxes. And if it turns out that they're not taking out enough in taxes, then they just raise the amount that they take out. So conclusion from this is that Social Security, not much of an issue, not that much of a problem. Is that if you have things to worry about in life, don't let Social Security be one of them. Medicare and Medicaid are in one way the same. So right now, people who are on Medicare, they're paid for by us, right? And so we also have on our paychecks a little tax that goes to Medicare tax, and that goes to CMS. So that pays for Medicare and Medicaid. In fact, usually it's a state that will take out part of the tax for Medi-Cal, and the federal government takes out the Medicare. So, but in either case, is that there's money that's going out, and so it operates the same way. Is that they have a trust fund as well. So Medicare is a trust fund that they've set up because they can do the same thing. They can project out how many people are going to be alive, how long they're going to live, and they can project how many workers there are, etc. The problem is with Medicare, what makes it different than Social Security is that it's hard to predict the cost. Like with Social Security, you know how much you're going to pay because the government decides how much they're going to pay. But with Medicare, it's like it just depends on how much healthcare costs. And so if healthcare costs are fairly low, then Medicare doesn't have to pay out very much. But if healthcare costs go through the roof, then Medicare has to pay out a lot. And so what's been happening is that healthcare costs have been increasing much faster than than kind of the amount that the rest of the economy is the regular inflation is. And so it means that what Medicare has to pay out keeps going up and up and up. And so Medicare is faced with this choice of, well, do they just keep taking more out of our incomes to pay for Medicare, or do they try to do something else? And Medicaid's even more complicated because Medicaid depends upon, if you think about like what our Medicaid cost is going to be, well, it depends on the number of people who are eligible, or depends on not eligibility, but who's actually going to enroll in it. And then it also depends upon how much the Medicaid is going to cost as well. And so, the problem with Medicaid is that they, people will be on Medicaid, then they might get a job that pays for the healthcare, so they'll go off Medicaid, and then they'll come back on Medicaid if they lose their job or they change jobs and need it. So people can go back and forth, and so it's really hard for Medicaid to predict how many people are going to actually be on Medicaid. And then they have the same problem in that people on Medicaid one of the reasons that a lot of people go on Medicaid is because they're ill and disabled, which means that you kind of have a lot of the high cost people that are going to be on Medicaid anyways. So Medicaid has the problem where that they don't know. It's tough for them to predict the number of people, and it's really tough for them to predict the costs. So the Medicare Trust Fund then has two different parts. It has a hospital insurance trust fund, and then it has a supplemental medical insurance trust fund. The hospital one is funded through payroll taxes, and the other one's funded through general taxes plus some premiums that gets paid. So this is like, the numbers at the end of 2017. So they were projecting what, $200 billion in surplus in their Medicare trust fund. And they're doing that because they're thinking, okay, in the future, we're going to have to pay more for Medicare. So therefore we need extra money. Now, how much did Medicare cost a year? Do you remember from the figures I showed? About $800 billion. So they have $200 billion extra, which means that they've got somewhere like a fourth of all Medicare costs in reserves. And that's the trust fund for the other one, for the supplement. They have about another $100 billion to cover Part B. But the problem is that when they project out the growth of Medicare, is that they project that it's going to be really, really expensive in the future. So that if you look at what's been happening in Medicare growth, is that it looks like in time is that, it may go up to $2 trillion. So the problem is, like, this is as a percentage of GDP, just Medicare in this case, Medicare and Medicaid. So not the total expenditures, but just Medicare and Medicaid. So if Medicare and Medicaid was now 20% of the GDP, then they'd be about $4 trillion. And so the whole government, spends about $3 trillion. So that's why when you hear them talk about how if this went on, is that Medicare would basically eat up everything that the government spent would be spent on Medicare. It's because they're projecting out. They're looking at the growth of Medicare expenditures, and they're saying, well, it will just, if it keeps growing at this rate, then the government won't have money for anything else, or would have to come through and tax us all an extra $2 trillion a year to pay for Medicare. So that's why there are all these solvency issues with Medicare, so there really are issues with Medicare in terms of how it can remain solvent, because you're seeing decline in the number of workers, you're seeing increase in the number of people who are going to be retired and get Medicare, and you see the cost increasing. The cost per person of Medicare is increasing. So they have a trust fund. So in theory, they could do the same thing that they do for Social Security. But the problem is that they look at the amount of money they have to put in there, and they think that there's just not enough money that exists to kind of keep Medicare at the same level. Okay. So Biden came out with his bill, with his budget a couple months ago, came out with it. And basically what he wanted to do essentially is to, up the Medicare trust fund, right? To try and keep it solvent for 25 years. So what he wanted to do is he wanted to put drug price negotiations and then a tax on investment for people who earned over $400,000 a year. So this would be so the solution here is that, and we'll talk on Thursday probably about what this means to basically negotiate drug prices. But the main thing that they're going to do is basically just put a tax on people, put a Medicare specific tax on it. So that is one way to do it, right? So one way to do it is to say healthcare costs are going up. They're going to keep going up. We need to get more money. So therefore, let's go ahead and do a tax. And we're not going to do a general tax on everyone. We're just going to do a tax on people who earn over $400,000 a year. So problem solved? Well, it doesn't really tell why it is that healthcare costs are going up so much, right? Because that's really the fundamental problem. If you think about the difference between, if you look at everything else that we do, you don't have the same problem with roads or with, transportation or anything else. The prices may go up when you have inflation, but it's not like it's going out of control. But with healthcare costs, the problem is that the fundamental problem is that the costs keep going up and up. And so therefore, you can find solutions to it that says, let's keep, having more taxes, but that doesn't really address the fundamental issue, which is that, well, why do healthcare costs keep going up and up? So that gets to the question is that, well, how expensive is our care? All right, so there's the number. So the US spent in 2021 spent 4.25, the US as a whole spent $4.25 trillion on healthcare. So our total economy is 18, call it 20,000 in 20 trillion. So that means basically 20% of everything that we spent was on healthcare. So that's a lot, right? If you think about all the other things there are in the world, in our lives, and that 1 out of every $5 is going to healthcare. If you look at where it goes, is that you got about 31% go to hospital and about 15% go to doctors. So that, overall, then you get about 45, 50% that goes to hospital and doctor care. Do you think that's more than the rest of the world? And when I say the rest of the world, I mean, like, I'm talking about, the OECD countries, the countries that we typically are going to compare ourselves to is Europe, Japan, let's see, Mexico is in there. Some of the, those are the main countries that we compare ourselves to. So OECD. So overall, 50% on hospital care. Do you think that's more than other countries, less than other countries? It's about the same. Most countries spend about 50% on hospital care to some degree. This is kind of who pays. So we have about 34% is paid for by private insurance. About 37% is paid for by Medicare. And then you have about 10% out of pocket. And, then other programs like VA and things like that are relatively small. So it's mostly, if you look at these two, private insurance and Medicare and Medicaid, that's about what, 70%, 71%. So almost 3/4 of all money comes out of those two pots. It's like in Merced County, what percent of people are on Medicaid, Medi-Cal? About 50. About 50% of people are in Merced County. In fact, most of the valley, about 50% are on Medi-Cal, and about probably 20%, 25% are in Medicare, and then you have about 15% on private insurance. And I should say Medicare, and then when I say it's Medicare and also just government, like, government employees. So someone who's being paid for by the government is an additional about 25%. So about 15% are private insurance, and then you have about 10% who are uninsured. That's the basic breakdown. Other places don't have as high of Medi-Cal as we do, but it's basically income based. So if you have an area with low income, you're gonna have high Medi-Cal numbers. If you go over to the Bay Area, you have lower Medi-Cal numbers and higher private insurance numbers. All right, so here's the amount that we spend per person. This is about 10,000. It's actually higher than that. This is 2017. It's up to about 12,000 now. So we spend about $12,000, $10,000 to $12,000 per person. And that Switzerland is the next highest, but then you can see all the other ones are kind of in this basic range here of somewhere between, the average is 5,000. So we spend about twice as much per person on healthcare as other countries. This shows our income, right? Our income and our healthcare spending. So here's our healthcare spending way up here. Here's our income is down here. So you can see that most countries kind of fit on this line, where the higher your income, the higher percentage or higher amount that you spend on healthcare. Except for the US, we're way up here. This is total spending. So across time, again, we're way up here. This is inflation. So this is how much prices rise in healthcare. So if you think about, like with Medicare, why is Medicare costs going up so much? So Medicare costs can go up for a couple different reasons. One is that people could use more things, right? So they're sicker, and so they need more things done for them. You can go up because you have more people who are there. So you have more people who need healthcare. And then you can also go up because you have higher prices, as that they charge more. So what this shows is that for the prices, that the prices have been going up, somewhere around per year between, well, the low was in here, but, up 6% and such. So you've had, this kind of around 4%. During this period, what was the average inflation rate? So what was the average inflation rate during this period, the last 10 years? About 1%. So the average inflation rate for everything was about 1%, and the average inflation rate for healthcare was about 2 to 4%. So this shows basically the inflation rate over time. So there are periods like here when inflation is really high. Right now we're about 5% here, so it's pretty high. Not as high as in the 1970s, but still pretty high. But the point of this is that our healthcare, we're spending twice as much as everyone else, and that our prices are rising twice as fast as everything else. So that means that we have a problem, right? If you look at the U.S. healthcare system, is that you say cost is probably the major problem that we have, because it's going to screw everything else as we go forward. People aren't going to be able, there's just not going to be enough money at the present trajectory to keep funding Medicare for like this, or any government program, or any private program. Because it's not the private is better than this. It's not like the cost on private care is actually higher than costs on government care. So it's something that goes across the board. So, all right, why does our healthcare cost so much? So we'll go through some different type of possibilities, right? So one could be is that we're getting better healthcare, in which case, not really a problem. I mean, if what was happening is that, as been said, we have the best healthcare in the world, and so therefore, we're getting, if we have the best healthcare in the world and we're paying for it, then not really an issue. It could also be is that we just use the hospital more. So maybe we're sicker and we use the hospital more, or that we see the doctors more, or that we pay more for medications, for prescriptions, or we pay more for waste, or we use more technology, or we pay more for our doctors. So we'll go through them quickly. So are we getting better healthcare? The short answer is not much evidence of it. So, depends on how you want to look. If you look at waiting times, well, the US, for waiting times for different types of surgeries, the waiting times tend to be low in the US compared to other countries. Problem with that is that the waiting times are low because the only people who get on a waiting list are people who can pay for it. And so if you don't have a doctor and you don't have a health insurance, then, regardless whether you need something or not, you're not going to be on the waiting list. If you look at countries, and we'll talk about this when we start talking about other countries, but in other countries like Canada and in Europe, countries with universal healthcare, waiting times is is a major issue for them. And the reason is because, they don't use cost as a way of, or ability to pay as a way of weeding out who gets care. Here we use ability to pay as a way of weeding out. And so therefore, if you can't pay, then you're not on a waiting list of anything, because you're not going to get treatment. Where in other countries with universal care where it doesn't cost anything, then more people go on waiting lists for things. So it's the same reason why in the VA hospital, waiting times is a big issue, as we talked about. It's because, if you get care through the VA hospital, you're not paying in the same way as you are with private insurance. And so therefore, waiting times become an issue. So yes, our waiting times are lower, but self-reported health, 89% report their health as being good or very good or excellent, and that's good. On the other hand, there's not that much difference between countries in self-rated health. Life expectancy, we're down the list, we're low for the OECD average, and that we're about 4.5 years less than Japan. Medical errors were the third highest rate of deaths from medical errors among OECD countries. And infant mortality, which is, as we discussed, infant mortality is a good indication of both, how good your healthcare system is and how you treat children. And we're very bad in infant mortality. Okay, do we use the hospitals more? Here's us down here in this little, in this sort of middle part right there. And so the answer is no, we don't use the hospital that much more. Other countries, they use, come back. Other countries use the hospital a lot more than we do. And you know this in that, because, one, they don't admit you to the hospital very readily here. And when they do admit you, then they try to get you out of the hospital. So, the hospital admissions are usually low here and hospital stays are low. Do we use the doctor more than other countries? Here's us down here. So nope, we don't use the doctor more than other countries. Japan is very high in terms of both hospital use and doctor use. They also have the highest life expectancy. Do we have more doctors' visits? That is that, this one is that, do we use it more, the number of sort of acute hospital stays, and then this one is the number of visits, and no, we don't have more visits. So if you look at that, you'd think, okay, so it's not that we're getting more healthcare. So it's not that you can look at our health outcomes and say, yes, we're definitely getting better health outcomes. Scratch that one. It's not that you can say we're using healthcare more. Scratch that one. How about, do we pay more for prescriptions for drugs? And there the answer is ding, ding, ding. Yes, we definitely pay more for prescriptions. And so when we talk about drugs starting on Thursday, hopefully, is that you'll see, we'll go through why it is that we pay more for prescription drugs. But the short answer is this, is that, yeah, we pay more for prescription drugs. And the reason is that, that other countries, what they do is they negotiate drug prices and we don't negotiate drug prices. And why don't we negotiate drug prices? Well, talk about that on Thursday. The Biden administration actually just changed this, right? One of the things in the Inflation Reduction Act from last year was that it gave Medicare the ability to negotiate drug prices. So we'll talk about that. But essentially what it means is that in other countries, if they want to, if Canada is going to provide drugs for a certain type of drugs for Canadians, is that they'll negotiate with the drug prices for the price. In the US, they don't negotiate. Medicare doesn't negotiate the drug prices, at least traditionally they haven't. And so here's some examples of what we pay for a certain type of drugs versus what they pay in other countries. So you can see is that we're, twice as much for other drugs, sometimes more than twice as much as for the same drugs as in other countries. It's why people oftentimes will do things like drive to Canada to buy their drugs, or drive to Mexico to buy their medications, because the prices that we pay here are 2 to 3 times as high. Okay, there's just some other drug prices. Drug price cost per capita spending on drugs were higher. Administration costs. Do we have higher administration costs in other countries? So there the answer is ding, 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 ding. Yes, we definitely have higher administration costs. And now administration costs, that means a couple different things. One is it means just the actual cost of just supporting healthcare providers. And the other thing it means is profits. So, we're going to have both those things are going to go under the sense of administration costs. So I'll give you an example. My uncle, he was a podiatrist, and he was a podiatrist, and what he used to do is he worked for Medicare. Podiatrists mostly deal with older people's toenails. That's a lot of what podiatrists do, is they deal with older people's toenails. So he used to have a deal where he would go to a nursing home. He would pay a nursing home for him to be the podiatrist for that nursing home. And then he would go in and, in a day, he could just go room to room to room and hit, 25 people in a day and, clip all the toenails and then send the bill to Medicare, and Medicare would then go ahead and pay for it. And so he made a good living as a podiatrist doing this. Then Medicare came along and said, no, from now on, this has to be bundled in with other type of care. And so, so it meant my uncle had to go through and deal more with private patients. And so then it meant that he had 11 or 12 different insurance companies at any one time that he was dealing with. So he had to go out and hire 2 additional people to just do billing. That's all they did, is they just tried to bill to these different private insurance companies, because all these different insurance companies have their own forms. Sometimes they don't want to pay, things like that. So it meant that he had to hire 2 additional. So rather than him and a nurse, he had then him and nurse and now 2 other people who were working there as well, who all they did is billing. And that's what you'll see in hospitals. You'll see in hospitals is that hospitals have to have a huge number of people who essentially do billing. So one of the things that they do is they do coding. They'll take what happens, like what happens to someone on the ward, and they'll put it into ICD-9 codes. And the reason they do that is because then they report it to Medicare and they get paid DRGs based upon the coding. So hospitals have a lot of time and effort that's spent on going through and doing all this coding. So, and that's all things that if you have a universal single payer type of care like the UK, you just don't need that, right? You don't need tons of different types of coders like that. You don't need to have, doctors don't need to have people who do the billing. It's much simpler. So all those things kind of add up to different types of administration type of costs. So here is, like in this case, administration costs on this side. So compared to other types of countries. So you can see is that the average is about $175 dollars per capita. And in the US, it's about $800 per capita. And what this shows on this side is just the long-term care per capita in terms of what it is that gets paid for, but that's another question. So yeah, so administration costs, ding, 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 ding. Definitely. It's also why, it's not shown here, but Medicare's administration costs. So the average administration cost for most insurance companies is about 35%, 30 to 35%. So basically it means a third of all everything that gets paid to an insurance company goes towards administration costs and goes towards profits, right? So that's a lot. Medicare, their average administration cost is 2%. So it's why private insurers don't really want to compete with Medicare, because Medicare has a very simple policy, right? You give us the ICD-9 codes and we pay you a certain amount. There's no negotiation. It's a single form. It's pretty easy. Where insurance companies have all these very complicated type of arrangements that they've made. So it's why when they start talking about, like, well, should Medicare provide something on Covered California, which is, they could, right? Uncovered California, when you go and look at all these policies, in theory, you could go and buy Medicare as well and just make it a pay for perform, you just pay it. So they could do it that way. The ones who don't want it is insurance companies, because insurance companies know that there's no way they could compete with Medicare. All right. Technology. So there's a couple things about technology. So first is there this idea of defensive medicine. So I think we've mentioned this a little bit, but what defensive medicine basically means is that it's the overprescribing of tests and treatments and things like that, just as a way of avoiding getting sued. And so the reason why this is kind of comes up is that is like, if you're a doctor and someone comes in and that they have a head injury, they got smacked in the head playing football, and then you think, oh, well, it could be a concussion, or it could be, just a head injury. What most other countries would do is they would say, well, let's monitor you for, go home and monitor you. If you feel sleepy or whatever it is, then definitely, go down to the emergency room at that point, right? Well, if they did that here, what the worry is that, and the person ended up with a head injury, they would then sue the doctor. So in other countries, you don't sue. Here it is that you sue. So it's the threat of being sued, which caused them to say, well, even though, you've got this, I don't think you have you have a TBI. Let's go ahead and get you an MRI anyways. And so you start to use other types of testing as a way of protecting yourself against being sued. That's what defensive medicine is. So the estimate is that it costs about $650 billion, these kind of unnecessary tests. Now, it's also a little bit hard to tell because, it's also the case that a lot of times people do tests, like do multiple tests because there's no information systems. They're not getting the information from the other provider who did a test. So if someone goes to their GP and the GP orders the test, and then they go to the hospital will probably just order a test anyways, because they may not be able to get access to the test results that the GP had. So it's the lack of information systems kind of makes it hard to see what's defensive medicine versus what's just, just bad communication. But it definitely is something for which it's a concern. There's also the idea is that well, in other countries, what they do is that they're much more accepting of not giving kind of heroic care at the end of life. So, for example, like these estimates that 28% of Medicare costs involve the last 6 months of life. So that's called heroic medicine when you try to do everything you can to keep someone alive, but really, even in the best circumstances, you're only going to keep them alive for another week or so. So this used to be a much bigger deal in the US, and it was kind of solved or it was kind of taken it's now been less of a deal because of hospice care. So what happens now is that if you've got an elderly relative who's on the way downhill and that they're not going to get better, that what they'll probably do is that the doctors will say, well, why don't we put you in a hospice care? And what hospice does is that sometimes hospice care is at home, sometimes hospice care is in their own hospital, sometimes hospice care is there in the hospital. But what hospice differs is that they can have like once you sign into hospice care, then they can not try to revive you. They can not do things like take you in the emergency room every time that something happens to you. So this happens a lot where, especially as people get more frail and that they start to have following incidents or whatever, where they're not necessarily they're just on the way downhill. If you don't have hospice care, then if you're in your residential home and you fall, they have to take you to the emergency room, even though the emergency room is not really going to do much for them. All they're going to do is get there and then be sent back home. Back to the facility, is that they have to do it. But under hospice, they don't have to. They will send you to the emergency room if it is an emergency, but they don't have to do it. And so hospice sort of tries to break this link between them providing all this type of end-of-life care in ways that may extend a person's life for a little bit, but not really that much. Whoops. Just deleted the slide. Try again. Okay. So then there's this other idea is that well, Americans like technology, right? So that's like it more in other countries. It becomes a little bit hard, and so I think I would point you towards kind of this reading that I have given you about the cost conundrum, which is a New Yorker article from a few years ago, but still relevant. And which the idea there is that, well, maybe it is that, that we just love technology so much that we're going to go through and that we're the ones who are just demanding. And what this points out is that this looks at the difference between two different cities, looks at Allen, Texas and San Antonio. And it looks at the difference in terms of what the cost is, because one's one of the most expensive places in the country. The other one is not one of the most expensive places in the country. And what you see from it is that a lot of the technology, the problems arise when doctors groups own the testing facilities. Because when doctors groups own the testing facilities, then it means that if you refer for a test, you actually get money from the test as well. And so a lot of the overuse of testing occurs because there's these perverse incentives whereby, you know, if I go through and I send someone over to get tested, is that it's helping the company that I own. So this is where, you know, kind of the sacred and profane thing comes in. Because if you ask, well, is it good for the person to get tested? It's like, well, okay, maybe, right? Maybe it's good, marginally good for them to get tested. But, and so there is like a reason why, but do they really need to be tested? Well, they wouldn't be tested in other countries. There'd be no clinical, you know, other countries, they would have they would say that, well, it doesn't meet the criteria where you need to be tested. So they have different criteria, but that doesn't exist here. And then expensive use of treatments. So we, you know, use more MRIs. We have many more cesareans than other countries. So there's also this idea that we have just more expensive types of technology that's used. So read the cost conundrum. And I'll tell you, we're out of time. So how about we start there next time? Oh, you want to see the answers to the questions? Okay, let's see. So this one. So what's the answer? A, B, C, or D? A. Mm-hmm. What's the answer to this one? Haven't got there yet, but it's going to be B. So just let you know, it's B. Uh-huh. Yeah. This one? Yep. It's about 10% go to prescription drugs. Mm-hmm. Yeah, because remember, it was like about 35% was for hospital, about 15% for doctors, and it's about 10% for prescription. Mm-hmm. Will this answer this one? Let me say D. Yeah. D, it's all of them. Uh-huh. This one? A, B, C, D, B. It's B, because the government can, you know, they can estimate the number of people and they can estimate life expectancy, but they just, it's the cost that they can't do it. Okay. See you Thursday.